Okay guys, let's remember where we started. I asked you what happens if you want to sell the product. First, you need to convince people that they need the product. Then, that the product delivers what is expected, an accelerated wound healing. And what is the last excuse some, let's say, resistant caregivers throw on you? Well, it's too expensive. We can't afford. And this is what happens not only with clinicians, this is also what happens with reimbursement systems and healthcare systems all around the world. And so we assessed the effect on the total cost of treatment. Let's go through it. This nice picture is taken from an American publication and shows the correlation between the impairment of function and of quality of life and the costs. You see, at-risk diabetics don't have that much problems with their life and with leading a normal life, and they're not that expensive. Once they develop a diabetic foot ulceration, it becomes more complicated. Patients are significantly impaired, have a loss of quality of life, and the costs rise. If then a foot infection and later on a limb loss follows this terrible cascade, then the costs go skyrocketing and the life quality drops down. So there's not more which could save more cost. There's nothing more that is better than improving the healing outcome. Once the patient develops a DFU, they need to turn it into a healed DFU. As a healed DFU brings them back on track and avoids these terrible cascade of loss of life quality and high costs. There's nothing cheaper than healing a wound. Granulox accelerates healing, and our hypothesis is that by doing so, it reduces the number of dressings that you need to bring it to an end, it reduces the number of nursing time, and of course you have less complications like infections that require antibiotic treatment or surgical debridements or all these procedures that are a consequence of a wound healing complication. And therefore our hypothesis is that although you need to pay something for Granulox, it helps to bring down the total treatment costs. And to assess it, and I told you that we applied for reimbursement in the NHS health system, the principal investigator meticulously documented every dressing used, every wound rinse used, and everything that was related to the wound healing in the 3 studies we've just went through. You see this, and in this exemplary case, the number of dressing changes in the Granulox group or in the cohort group, the cost of drugs that needed to be applied as a consequence of a wound complication, or of course the costs for Granulox application. And if you know, have a look at the results in the diabetic foot ulceration study, in the chronic wound study, and in the sloughy wound study. You see the total costs per patient in the actual Granulox cohort and in the control cohort. And in all cohorts, we had massive savings that amount to more than 50% of the total treatment costs. Adding Granulox does not only mean an improvement in healing, it also means a significant reduction of total treatment costs, which makes it to me one of the very, very few developments in medicine where a higher medical outcome correlates to lower costs. Normally, it's the other way around. This setting was then adapted to the German healthcare system, and we asked a well-reputed healthcare expert. It's Professor Bruggenjürgen from the Steinbeis University, one of the leading institutes in health economies. And he compared the German treatment setting with the healing outcome and founded his assessment on real-life data from the sick funds in Germany. And he came to the conclusion that a Granulox treatment actually is less cost-intensive than a treatment without Granulox. So although Granulox is not for free, the total treatment costs are significantly reduced. Summed up, our body of evidence, comprising more than 60 publications, give evidence to massively accelerated healing, to enormous cost savings, to an increased patient quality of life, and overall, which is very important for you, since launch we have more than 60,000 patients treated in more than 30 countries. We have a very strict market surveillance system. We have a fantastic reporting system, and this is a medical device class 3, and no adverse event has been reported that was attributable to hemoglobin. You have a safe, cost-effective, and healing accelerating product in hands.